Welcome back to Empowerment Nursing. I'm Linda and this is Ashley, and you're tuning into our series In the Know, where we make it simple. Today we are simplifying delegation. If you don't know your content, you are not going to be able to delegate appropriately. Delegation comes down to two principles: the rights and the roles. And now we're going to simplify that, going to our iPad here. Okay, so we're going to first talk about the rights. The right task. And this is where we consider knowledge, skill, scope of practice, and the stability of the patient.
So in order for the person answering the question or the nurse to properly delegate, we need to know the knowledge level, the skill level, the scope of practice of all the possible people to delegate to, which usually includes a registered nurse, a practical nurse, and a PSW, which we're going to talk a little bit more about in the roles, as well as having an in-depth knowledge and ability to critically think around the stability of a patient, so therefore knowing disease processes, expected symptoms, etc.
The right situation. So considering time constraints, workload, and circumstances.
So an example of considering the right situation might be in the stem of a question, if it says the nurse is reassigned from a post-operative unit down to a critical care unit, you would want to take into consideration that situation and knowing that that post-operative nurse is most familiar with post-op patients, and you would want to choose the assignment that most closely represents the floor that nurse comes from in terms of properly delegating any task or any patient assignment given that situation.
The right person, you're going to consider the scope of practice of the person you are delegating to.
And we're going to get more into that when we come over to the other side of our mind map here and we talk about the roles of the different nursing personnel we're able to delegate to.
Right instructions. We're going to explain the task clearly, including expectations and outcomes and reporting back.
So anytime a registered nurse delegates to a practical nurse, also known as an Lpn or Lvn, or to a PSW, personal support worker, also known as a UAP and UCP, anytime something's delegated down to another individual, it's of primary importance that you're fully explaining the procedure. So the option in terms of the answer that gives you the most amount of detail is going to be the correct answer. So you need to explain it from A all the way down to Z. You need to ensure that person is competent. You need to give your expectations, including the outcomes and when you want to be reported back to, because ultimately whoever is doing the delegating, typically the registered nurse, is the one who remains responsible.
And the right supervision and evaluation. We're going to consider the required teaching that's necessary, intervening when necessary, and evaluating completeness and outcomes.
So what this means is that the registered nurse is ultimately responsible for supervising any care that's delegated and evaluating the accuracy, completeness, and outcome of any task that is delegated. Meaning you have to assess somebody's ability to delegate, to carry out a task if you intend on delegating to them, to assess their competence in completing that task, and then also supervising and evaluating the correctness of that task.
Now we're going to go over to the second principle that delegation comes down to, which is the roles. We're going to start with UCP or UAP, also called PSW, this role, and they are only assigned standard, unchanging procedures that are the same patient to patient.
So an example of something that may be delegated to a UCP or UAP or PSW might be different activities of daily living, also known as ADL. So these are non-invasive procedures. They might include feeding patients, ambulating patients. Now that being said, you also need to know your content and be able to critically think, because would you send a PSW to feed a patient who has a diagnosis that would put them at risk of choking? No, you would not. Would you send in PSW to ambulate a patient who's had a stroke? No, you would not. some tricky questions in terms of, non-changing procedures. An example might be, would a PSW be able to complete daily weights on a patient? Yes, if that patient is stable and unchanging, so a chronic diabetic who has no acute problems or no medications that might alter their weight, etc. But a PSW could not perform daily weights on somebody with a diagnosis of congestive heart failure, right? When decisions and assessments and judgments need to be made and that patient is not stable. So you have to have the ability to critically think and have the disease knowledge process to come to the correct answer. You can't just rely on the principles in these situations.
And next we're going to talk about the Lpn Lvn, or also referred to as RPN or PN. And they are only assigned stable patients with expected outcomes. So patients can be very sick but stable. Patients can have symptoms that seem risky, but the key is that they are expected. So this includes everything that we spoke about with the UCP, UAP, and PSW, plus the only assigned stable patients with expected outcomes.
So the Lpn, Lvn, RPN, or PN can do all the things the PSW can do, and we can now add on some nursing tasks such as giving medications, not including any complex IV medications or blood administration, changing dressings, catheterization. They can review teaching that was originally initiated by the registered nurse but cannot initiate any teaching. So that's important to note. It's also important to note we're talking about principles for writing your registration exam, which may or may not be what you see in practice, right? So what you see in practice, you may see practical nurses giving IV medications, and that's okay, but not on the registration exam are they able to give any complex intravenous medications.
So now we're going to talk about the registered nurse. They must complete, cannot delegate anything requiring teaching, assessment, or judgment. So their role is made up of what the UCP, UAP, and PSW can do, what the Lvn, Lpn, RPN, PN can do, plus now they have this responsibility of teaching, assessment, or judgment.
So a few key things to mention about this, anything that requires teaching. So as an example, the registered nurse must initiate the original teaching to the patient. So you could never delegate from an RN's role any person who's being discharged, because that requires discharge teaching. Anybody who's newly diagnosed, because that requires teaching of their new diagnosis. Assessment, the RN cannot delegate anybody who's newly admitted, because that requires assessment in terms of their admittance. Or anybody awaiting a diagnostic test, that requires assessment. So an example of this would be if a patient is waiting to go to X-ray, that doesn't sound too unstable or too scary, right? You might want to delegate that to the practical nurse, but you can't, because that patient's stability is unknown. They require assessment. We don't even know what's wrong with them yet. So that patient's very unstable, although they're just sitting there waiting for X-ray. Anything requiring judgment. So if there's a lab value involved or a diagnosis involved, that you're going to have to make a decision based on what you're going to do next, or interpreting lab results, that is the registered nurse's role.
So content is everything. You need full comprehension of the rights and the roles of the interprofessional team in order to be able to answer correctly delegation type questions. For more in the know and for all concepts simplified for your registration exam, check out our complete study package and our section on delegation and management. See you next time in the know.
Bye for now.
Bye for now.